Next up, we have Paul Attenborough. Paul is a lecturer in osteopathy at RMIT and the clinical coordinator as well. He has an interest in clinical education and technology-enhanced assessment and is currently co-developing a software application to facilitate assessments, including OSCE, so that's very interesting. Really excited to hear from you, Paul.
Thank you, Megan, and thanks for having me, everyone. So I'll just get my screen shared. I will share the whole desktop because I'm going to be flicking between presentations. So could you just confirm if everyone can see that okay?
Yep, all good. Thank you.
Yeah, wonderful. Okay, so thank you again for having me. So this presentation is looking at my first go at PebblePad, which has been, I think, a really good journey. As anyone who's used it would know, that there's been a bit of investment of time in learning the language and the way that it works, and I think it's really paid off. And firstly, a massive shout out to Mark Derbyshire, who helped me a lot along the way. So I obviously came up with some of the ideas and how I imagined it looking, and he had the technical prowess to make it happen. So thank you for that. And I'll be talking through what this portfolio looks like. So placing the clinical portfolio, it sits in the last 2 years of a 5-year program. So the osteopathy program goes for 5 years. The clinical placements begin in semester 1 of the 4th year, and then they run through for 4 consecutive semesters. During that time, students need to demonstrate their clinical and professional capabilities before entering the profession. And when they graduate, they're eligible for registration under APRA, and they become practicing osteopathy service providers. And so you can see there from those yellow tiles that I've highlighted, that's kind of where I sit within the program. We have to demonstrate through our program that students satisfy and meet the capabilities for osteopathy practice, which you'll see is probably quite similar capabilities to other clinical programs as well. So just to rattle off a few, being an osteopath being one of the core ones, demonstrating professional and ethical behavior as a practitioner, being a good communicator, critical reflective practitioner, etc. So that'll help you understand what I'm trying to achieve with some of these assessment tasks and activities, that because it sits in the clinical part of the program, I'm really trying to align them with these key competencies and key capabilities. So by the end of completing these portfolios, they can then present that and they can use that as evidence to say that they've achieved those things. The ideas I had in creating this portfolio were that, so we also have another portfolio course where they focus a bit more on a professional portfolio. So that just helps to understand as well that this is really focused on their clinical activities and bringing those clinical experiences into a portfolio arrangement. So the student-centered focus is trying to get them to understand that they're going to drive their learning and they're going to start identifying relevance in those, I guess, those activities and the things that they're doing. We want it to be experiential. We want them to draw from their clinical encounters and their clinical activities and bring that into some of the assessments and activities that they're doing. Being a reflective practitioner is part of one of those core capabilities. So there's quite a few reflective activities through the portfolio. Always focusing on evidence-based practice. And one of the changes I made when we went to this portfolio was that instead of doing a formal literature review, which I'm sure a lot of disciplines do, I broke it down into a more truncated version of, examine the literature and apply that to a particular case study, just to try and make it a bit more clinically relevant, because most people who graduate aren't going to become researchers and, be generating literature reviews. They're going to be looking at the literature and applying that to authentic cases. So a few little changes in the culture around a literature review assessment, focusing on competency-based assessment to know that what they're doing is actually relevant to what we're trying to achieve through their assessment. And probably the main shift in my thinking around this was applying a more longitudinal model. So instead of having 4 isolated semesters where students submit their work and they sit within Canvas in those semesters and they don't kind of interact beyond that point, the goal of this was to create a more dynamic portfolio that will carry across all 4 semesters, where they can reuse and they can reflect back on and adapt and adjust, and hopefully creating some kind of linkage across all 4 semesters. So what is the clinical portfolio? In practicality, it's a PebblePad workbook template where I've created specific resources and tasks, and the students are required to complete each of those for each clinical course. And so the assessments already existed. They were already kind of scaffolded across the 2 years, but basically I've brought them in. So as well as having some general information, links to resources that they need to be in their clinical placement, instructions on how to use PebblePad, some web links and resources. They've also got, for each clinical portfolio for each course, there's nested assignments, and all of those are aligned to the CLOs and have that mapping across the 2 years of the clinical program. There's a log of their attendance, so students can actually track, when they're away, when they're there, and they can build up that tally across the 4 semesters. And then there's a collection of different types of feedback. So there's scoring feedbacks, there's written feedback. We've got some review feedback templates. So the clinicians, the supervisors will sit down with the students and talk through their progress and talk through their strengths and their weaknesses, and go through a bit of a feedback loop. And all of that information is then captured within a template, and then it's collected into a certain page, as well as having self-review. So the students can review themselves against the same template and then discuss that with the supervisor, and the supervisor can say, well, actually, I think you're overrating or underrating yourself there. And so all of that feedback and that process is then collected and stored within each of the portfolios. So the outcome I was hoping to achieve, which I think I've kind of mostly got there, is that by providing a kind of like a template shell, it would allow students to complete different assignments, tick off their compliance tasks, log their clinical encounters, do their reviews, do their feedback, and develop a body of work. So by completing each one of those tasks, they're starting to build evidence of their growth and their development, and they can kind of continue going back and forwards through those assets and through those experiences. So they might use a reflection, at the beginning of the semester, and that might be based on a clinical encounter, and then they might treat that patient again 6 weeks later, and they can come back to that reflection and then, look at their growth. So the idea is that they'd be ticking off these requirements and building up a body of work. But in doing that, and this is probably the sneaky bit that I haven't made them totally aware of yet, is that they're also building up their asset store. So what they're looking at the moment and what they're interacting with is this sort of structured portfolio that I'm, predetermining for them and that they're completing tasks within. But they're actually building up this massive collection of assets within their asset store, which they can then use, and this will be the iteration in 2026, is that the final portfolio course will be a breakdown of the structure, and we'll be saying, now I want you to build up your own portfolio using all of those experiences and all of those existing assets and create your own portfolio. So the idea is that by structuring it the first time around, it's helping to guide learners around using the software, developing their literacy, their knowledge around the way that it works, and showing them what portfolio looks like so they can then do it themselves in a later assessment task. So what's it made up of? It's essentially a workbook template. I've built in static documents in there, so the worksheets which have instructions and resources and web links, so they're not going to be editable. They're just something that I want to be static, so students can always refer to that. For example, we have an online leave form that if a student's not going to make their shift, they complete, a Microsoft form, and that has an automation that notifies our reception team. So they can just click into that from the workbook. There's links to different will resources and sites. So all of that's just sitting in a worksheet structure. Then there's a series of placeholders where they are editable. So students will actually, complete their assignments in the form of a folio page or a blog page, and they'll be doing that within the PebblePad template. There's the attendance log, which I've used a table for, which just has a really simple tally function at the end, so we can quickly flick through and see, how many shifts students have attended. And there's also the patient log, where it's a template that they will fill in, where it says, this was the age bracket of the patient, this is the type of condition, this is what I learned, those sorts of things. And by saving each of those templates, that'll then log that into a collection. So they'll develop a collection of their patient encounters that they can use again for other assignments. So they can think, 4 weeks ago, I saw that patient that had a rotator cuff injury, and now I've got an assignment on using orthopedic tests for rotator cuff injuries. So I can draw that resource out and I can reflect on that and use that in my next assignment. And then there's a bunch of different feedback templates. So there's the sit-down review and the self-review where students will kind of self-rate themselves and the supervisor will, tell them what they think is happening there as well. And then there's also this scoring of assignments, which is the more traditional style. And thank you to John for your presentation before. I had some of the same experiences in terms of lessons learned, the challenge of using those feedback templates and not being able to automatically carry across scoring. So I found the templates really useful. And what I ended up doing was using a scorecard. So it was a scorecard for all of the 4 nested assessments that applied to the clinical portfolio in totality. And then that was the score that was pulled across into Canvas. But it would be fantastic if those scores were auto-generated into Canvas from the rubrics. So I've just got a couple of screen grabs from what they look like. And again, it's quite a simple document. This was my first time using it, and I spent a lot of time trying to understand how it worked and how I communicate that with students, because I really needed to bring them on board and give them that deeper understanding of how it works so they could use it more naturally. So it's a pretty simple format and just using some of the templates that exist and some of the images that exist within PebblePad. So this is just an example of an information page, and you can see from the top there's a drop-down menu where there's a bit more information and other resources. That's the online leave form. Then I've got the nested assignments, and so you can see there's part 1, 2, 3, 4. I've just brought up the page, and for this one it's a convincing argument. So in this they had to, based on the literature review they did in part 2, they'd then have to form a convincing argument and present that as a webinar. And so that was embedded as a video webinar, which I'll show you an example of in a second. And then there's an example of how we logged clinic attendance. I'd like to develop this a little bit better. So there's a way to report this more easily, draw out a report. At the moment, this is just stored at the end of a table. So it's something I can use to cross-reference with the way that I log attendance more formally. So I have another way of recording that and reporting that. So I'm hoping that I can merge those two processes and reduce a bit of duplication by doing that. But this is really to get students into the headspace and the use of logging their own attendance. So it was kind of a stepping stone to the next thing. Then we've got the patient log. So that's just a placeholder where there's a collection just sitting outside of the shot, where when students complete those templates, it'll start logging all of those and collecting them in one spot. And very thankfully, one of the students from my semester 1 course, also semester 2, but they've allowed me to do a quick walkthrough from their semester 1, the PebblePad intro. Hopefully everyone can still see this. Let me know if not. And you can see here for part 1, she's done a fantastic job of this reflective journal, which is an iterative process that goes across the whole semester. So you can see there's a bunch of different video reflections. There's a few kind of written reflections which you can click in. And this person actually has a bit of a background in the creative arts and used to be a dance teacher, as well as now is about to graduate as an osteopath. So some really fantastic level of depth in the reflections and lots of musings. And I really enjoyed this reflective journal. So you can see there's video after video and, talking about, digital tenderness and, the ability to touch and how that meshes with, an evidence-based practice where what we feel isn't necessarily what we measure, and trying to, I guess, resolve that conflict. So some really interesting reflections talking about form and the golden ratio. So this is a really nice example of someone who's used mixed media to kind of reflect on their journey over the course of the semester and in a really meaningful way. There's a little sound grab there, which I won't play any of these because you won't be able to hear the audio. So that was part 1. That was something that happens across the whole semester. Then there's the more formal adaptation of the assessments that used to exist in Canvas. And so with this one, instead of doing a single large literature review with all the formalities, we've said, okay, we want you to break it into 2 and, do a literature review on this, but I just want you to focus on drawing the literature and interpreting that and synthesizing, that into clinical practice. And that was quite a nice change. I think students appreciated, having a bit of a breakdown of the formality and just maybe understanding why they're looking at the literature. Then we've got a presentation. This is the convincing argument. So you can see it's a 15-minute webinar. And the last one is, again, just a written reflection. And I quite like that this student's gone to the extra depth of choosing different images that sort of, I guess, match the thought process that she was going through. This is just an example of what the clinic attendance looks like. So you can see that there's placements at sports and placements at an aged care setting and back in the RMIT health clinic. And just noting, I was away this one. And so the simplest way that I tallied that was just saying that if you were present, it's a 1, and if you were absent, it's a 0. And so I can pretty quickly look at, whether their absence or attendance matches what I've got on my records. But again, that one needs a little bit of work. And then this, I think, was a really great addition because this isn't something that students had readily had access to prior to this, is that once they log their patient encounters, it will actually store this information and collect it. So you can see there's 37 patient encounters for this semester. And if I just click onto one of the random ones, you can see that it's talking about whether it was new or return, what was the diagnosis, intermittent left sacroiliac joint instability, recurrent, intermittent, was there any form of diversity? What was the age group? So these are all criteria, or I guess data that we need to show our students are being exposed to a variety of patients within the clinical setting. That's important for our accreditation. Then we've got the clinician reviews. So again, this is one of the reviews that the clinician did for this student. They sat down and said, you're ticking all of those boxes. You're doing a really great job. And again, these are matched against our graduate capabilities. So specifically focusing on professional behavior, not necessarily all of their clinical procedural skills and knowledge, but looking at, are you engaging in continuous enhancement of professional activities? Are you working in a team collaborative environment? So these are sort of looking at some of those professional attributes rather than just the clinical stuff. And again, the benefit of having something like a self-review against the same criteria is that you can see from this student that they've sort of oh no, I didn't demonstrate that. And the clinician said, actually, you have demonstrated that. So that's a really nice opportunity to help the student understand what that graduate capability means. So they might have said as a self-reflection, I didn't actually demonstrate collaboration. And they said, well, you did in all these different ways. So I'm actually going to give you a satisfactory score. So that is what the portfolio looks like. What's next and lessons learned? Like I said, John, I had similar learnings in that the interface between PebblePad and Canvas. Once I figured out how to do it, it worked really well, and Mark helped me with that in using that scorecard. So it was a single percentage score that got dragged across, which means that all of the students were looking at their scores and their feedback within PebblePad. So they were using that software to get all of their feedback and sitting within the one kind of system. And then the final score was just exported into Canvas. So step one was to socialize the software, to develop some literacy around it, to give a simple version that students could interact with, and hopefully build that familiarity so I could then allow a bit more autonomy in how they use it. Step two, in for a penny, in for a pound. The next step will be scoring all of their clinical assessments within PebblePad, which just means that instead of bringing up a Canvas rubric, the supervisors, the examiners will bring up a PebblePad rubric. And again, we'll just be drawing those scores immediately back into Canvas. So that'll include the mini CEXs and the OSCE assessments. We'll be building additional resources within the workbook and reducing some of those external links. So what I haven't built in is, video introductions and YouTube resources and things that they can look at within that space. I've kind of linked out to resources that they need, and I'd like to change that. So again, so they're living within, as much as possible, just living within one ecosystem. I'm hoping to customize the banner images, so using some RMIT branding instead of just the standard template images, but pulling some of that RMIT, the logos and the colors, and into that space so it looks a bit more on brand. I'm actually quite excited. I've set up a face-to-face session in the computer labs for the beginning of semester 1 next year for the 4th years. So the things that I was trying to do on the fly and in online meetings and via email, trying to help students learn how to get it set up and how to use the software, I'm going to sit there with them for an hour and basically go through all of it and get them to share their pages via Atlas. So all of it's already done, which means they can just focus on completing the work rather than those little technicalities of trying to share via Atlas and saying, I've already shared it, and saying, no, that's the wrong asset, and having to move it in different places. So all those things that I'm sure everyone has been doing as well. one of the key reasons we use this was because we're going to be using more and more external internship placements. And those external supervisors will need to score our students, and they can't do that unless they have an RMIT account. So we'll be deploying this externally and training supervisors how to use it. And that's the end of what I wanted to say. So thank you for listening, and very happy to answer any questions.
Thank you so much, Paul, for sharing your experiences. That was amazing. I love the focus on the evidence-based practice that is matched to your CLOs as well across the program, and that longitudinal model to have a clinical portfolio workbook that connects across all the semesters and building evidence and evidence in growth and development over time. We have a lot of questions for you, so I'm just going to get into it. So first one is from Tony and Jeanette Boyle. Can the attendance report be signed off daily by the mentor on PebblePad?
Yes, there's a function for that, and it's really funny. The reason I didn't use it is because in our in our clinic space, we're not allowed students to use their devices, and so I think that's where I'm going to move to. I think that's a really sensible way of doing that and logging that more formally. And I wasn't prepared for the battle I had to have in changing some of our standard clinic procedures to allow that. So I think now that I'm a year into this and PebblePad's going to stay and we're going to be expanding it, I'll probably be able to make the case. But yeah, I think that's definitely one of the changes I'll be making.
Yeah, I think that sort of leads into a couple of questions that Helen Crawford has put into the chat as well. How do you get your vision of what PebblePad could be used for and how it could be used, seen by your colleagues, and enable that to become a reality?
That's a really good question. So you'll be hearing from Julia McCorkle a bit later on today, who's been using PebblePad as well. And the two of us, with Mark's help, have probably been spearheading the use of PebblePad in that fairly robust way. So rather than kind of fairly simple versions, trying to build quite a lot into it. So I think now that I've got for the 2 year levels, in a couple of weeks, I'll have 4 completed portfolio examples. That's probably just, again, about socializing it amongst the team and saying, this is actually really useful. Now that we've got a bit of knowledge behind us and some skills in how to do it, not everyone's going to have to go through that same sort of deep dive to understand it. Because I actually find it easy to use once you figure out how it works. And it works a little bit more similar to building a little website, which I've done before in a previous role, building something in G Suite. Whereas not everyone has built a website before. So for me, it actually works quite intuitively. And I think just trying to understand how to translate that and giving some visual examples. And Julia's work is amazing. So you'll see that soon. I think having those working examples will bring people on board because they get to see what the students see. I think the first thing that you encounter is your own administrative challenges and the time that it takes you to develop any teaching learning resource. So that's the first experience you have as an academic. And I think when you see the final product, it's much easier to make that point.
Yeah. And there are another question from Helen asking how you teach your clinicians there. But there was also one for that I was wondering with regards to the students. You bringing them on the journey is really important. They need to understand. Yes, they need to understand how to use the tool, but understanding why the activities that they're doing are important is really a big part of having them really buy into the process, record things of value, reflect on things as they go through their processes. Anything around the clinicians
absolutely.
there that you could provide some tips for?
Yeah, so I guess the whole way I approach this is, to me, this portfolio looks like an unfinished work because I know where I want it to be, but I had to be fairly pragmatic about how much I could get this across the line for everyone. So for context, we have about 32 different clinical supervisors per semester, because we've got about 200 students in a cohort and there's lots of different clinical placements. They're going through aged care settings and sports and external internships. So my first goal was the light version. So every clinical supervisor, the only time they had to use it this year was to do the clinician review feedback template. So I gave them one thing that they needed to do. And by doing that, it meant that they knew how to access Atlas and knew how to open a template and submit it and save it and, publish and hold or publish and release and all those sorts of things. So my first goal was just to give everyone the light version. And then there were 4 assignment marker. So there were 4 people I used who scored the submitted work, which means they're the ones that are probably going to be able to lead other people in the next version of things. So they're the ones that have spent more time in Atlas and done a more of a variety of activities within PebblePad and seen different activities within PebblePad. So the goal was this year to just edge it in and get people to use it in whatever minimal amount I could get them to, just so it's familiar. And then next year, that's where all of these assessments will be scored within PebblePad because they've now done their trial version.
Yeah, lovely.
Yeah.
And there was a comment and a question in the chat with regards to Kate Mitchell put in how the workbook works for your staff and your students and your clinicians when there's instructions over multiple pages, because she's found that sometimes having the instructions on the same page for the students and the supervisors, one, makes it very clear who's doing what, but also if it's on the first page, it's always going to load when you get through to the submission in Atlas as well. So I think it's all that being clear, and Emma's also provided a suggestion in the chat for anyone who can access and have a look at that as well.
Yeah, and that's a really good point. I do think that maybe some of the ways I laid it out created more complexity than was necessary. I think I was still experimenting with those drop-down menus, and instead of having, like, I quite like the way that the 4 assessments sort of sit like that, because they are different tasks that you kind of click through, but they're related. Whereas that introduction page, I found I probably didn't set that out the best way. So probably having more of a continuous stroll with different drop-down features within one page. So yeah, I think that's a really valid point, thinking of the way that it works. And sometimes you need to see it not work before you can figure out how to do it better.
True. Yeah, that lived experience is super valuable, isn't it? I did have a question here from Michael, and sorry, Michael, I am going to get your last name very wrong. Parzakonis. In this example, are the video recordings an inbuilt feature where students can just click and record?
We did hit some challenges there. So because everyone uses a combination of Android and Apple, and someone will record off a webcam on their computer, they tended to record it outside of PebblePad, and then they had to drop the video into their asset store and then embed it within the page. I'm not sure if there's a more simple version than that. I'm not actually sure if you can record it within the page, but I know that eventually it has to be stored in the asset store because that's how it draws and is presented within the workbook. But I also think that that's probably, if I look a bit more holistically, that's one of the reasons I'm using this mixed media, is to get students to develop that digital literacy so they can manage different file types and convert and store. And so that's, I guess, part of that sort of meta reason for using this, is that they actually develop the literacy around managing file types like that. So that was one of the more challenging parts, I think, for students, but I'm pretty confident that they've now figured out how to do it, and that's a win.
Yeah. And
came at a cost, but it's a win.
Well, look, everything weighs out, and I do appreciate the fact that it's around building that digital literacy that is transferable for the longevity of your professional career, honestly. We do have the capability in Pebble Pocket for students to record directly in there, and then it can save through to their assets store. But that's something that I'm sure that Tony has got on the wish list for product further down the road, to be able to record in platform in the web browser as well. Kate has noted that she would love to see more examples of OSCEs, noting it's a key area of growth with the TEXA assessment reforms. There's a lot of other comments and questions and appreciation in the chat there for you, Paul, but I think we've kind of come to the end of time. Any last minute thoughts from you?
I'd probably just say to Kate, or anyone who's interested in talking about OSCEs, that's my happy place. So if you are looking at developing them, more than happy for you to contact me at my RMIT address, and we can have that conversation, because that's where my research and my software development sort of little thing is happening. So more than happy to chat about that.
Megan,
that is awesome. Yep.
Megan, there's a good question there from Cecilia. I don't know if you saw that one.
Oh, I think I might have missed that one. Sorry, Celia. Okay, so Celia's question is, after the internship or placement is finished, do you usually export the PebblePad workbooks for audit purposes, or do they just stay in PebblePad for ongoing access?
I haven't exported them, so the way that I'm using them at the moment, and very happy to take some advice around how this could be done differently. So for me at the moment, they're just sitting with the student, so they create the the portfolios, and I can access them and I can flick through each semester and each student. And then the goal is that in their final semester, which is just pre-graduation, obviously, that the next version is that they'll build their final portfolio using all of those resources and experiences that they've developed over the 3 semesters leading up. So I think that final version I'd like to have as a way to export and store for accreditation purposes. I haven't had to do that yet, so because it's not we develop our evidence in other ways, that what we present for graduation and accreditation. So I haven't needed to do that yet, but I think that's a sound idea, is that whatever the final version is, that we can actually kind of keep that and store that separately outside of PebblePad.
Yeah, absolutely. And you can export those submissions out as PDFs.
I'll probably end up doing that this afternoon now.
Okay, have a play with that one. Yeah. Awesome. Thank you so much. Like I said, there's still some comments, questions, congratulations in the chat. So I'm sure this conversation will keep going throughout the day.
Great. Thanks, everyone. I'll try to get to your chat questions in a sec.